Why do I need a PT evaluation before starting treatment? Even though you may have seen an MD and have a diagnosis for your pain, a physical therapist needs to evaluate the way your body responds to the pain. They analyze movement patterns and dysfunctions so as to improve the body's ability to function optimally and pain-free.
Why is eccentric strength important for injury prevention? It is important because tissues in your body needs to absorb energy in order to reproduce it out into your functional movements. If your muscles are not able to absorb that energy, it can lead into injuries.
So you might be asking, what does a typical physical therapy session look like? So typically, initially, your physical therapist may ask you questions about how you're feeling that day, how previous sessions went, to kind of gauge how your response to the sessions went. From there, your physical therapist will most likely incorporate hands-on techniques, which include but aren't limited to joint mobilizations to help with stiff joints, soft tissue massage or manual stretching to help with tight muscles. There's something called manipulations, which uses careful, direct manual force to improve connective tissue, joint, muscle mobility. And then also we can utilize tactile cues to kind of provide feedback to help teach a particular motion or to help aid in activating particular muscles. Lastly, we can utilize modalities, which includes ice, heat, electrical stimulation, ultrasound, all of which help assist in the rehabilitation process to help with pain, reduce swelling, reduce muscle spasms, or to improve blood circulation.
So my MRI says I have degenerative discs. Does that mean I have to stop exercising? Now I think there's a lot of fear mongering in today's society about back pain, low back being a very fragile part. Every day you see in the news or you see like people stopping exercise or saying I used to do this but now I have back pain. So in reality, the back is like one of the most supported structures in your whole body. It has not only an amazing ability to brace and provide structure to your body, but also has an amazing ability to heal from injury. So you hear a lot about people with slip disc, degenerative discs. You don't hear about people recovering from those things. In fact, if you look at the statistics on this, by the time you're 20, 1 in 3 people already have some sort of disc degeneration going on. By the time you're 50 years old, that number jumps to about 80%. 4 in 5 people and 3 in 5 people already have a bulging disc. So that number only continues to climb as you get older and older. By the time you're in your 80s, it's practically 100% of people. But I'm sure you and I both know people that are in their 70s and 80s still exercising, still being healthy, most of them pain-free. So what does that tell us? Does that mean MRIs mean nothing? Well, no, not necessarily. The MRI is a tool. So an MRI is a picture of your body from a different view, right? It tells you some things. Just like if I took a picture of your face, right? There's some things I can tell about you. I can tell if someone has 2 eyes. I can tell if they have a nose. I can tell if they have any piercings or not. But I can't tell some other things, such as what their name is. I can't necessarily tell what their nationality is. I can't tell how old they are, so on and so forth. So an MRI is a tool that we use to diagnose, but it's not the end-all be-all. And it's certainly, just because you have degenerative discs in your body doesn't mean that you have to stop doing things. You can still do things very well. It just depends on your intensity and how well you can build up your strength and tolerance to these things.